Hi, my name is Kelly Hubbard. I'm the Executive Director at Hospice Simcoe in Barrie. We have been we're a charitable organization that has been in our community for 30 plus years, providing end-of-life care and bereavement support to those in Simcoe County.
Hi, I'm Rolly Ramey, Managing Director, co-founder of Season Center for Grieving Children, which was established in 1995 in memory of my two daughters. We provide peer-to-peer support for children ages 5 through 24 and the various type of loss experiences they may have gone through. Well, we've actually been partnering for many, many years. This has been a vision of ours for quite some time. But truly, we've been partnering in many, many ways throughout our years together in this community. And within the last 18 months, we focused on a true partnership and a full-on amalgamation. And there's so much excitement around that, in that as a bigger footprint, we may be able to impact the community in a much better way.
Right. Even from 15 years ago, when the residential facility first opened, we had a young individual that had 3 children, and from that moment on, it was like, how can we help these children? We didn't have the expertise as Hospice Simcoe, and the first person we called was Season Center. They are the experts. They are the known experts, and it's very rare for any community. We're so very fortunate to have Seasons in our community. So we called them, and since then, we have just been working on children's grief and bereavement and ensuring that we are filling all of the gaps so that every child that has a need for bereavement support gets filled. So we really worked hard to not duplicate services, but to fill gaps between the two of us. So whereas Season Center really works on peer-to-peer group work, and Hospice has sort of filled in on those one-to-ones that maybe don't necessarily fit into that group environment. So we've learned from Seasons. They have helped us to grow our programming to allow us to provide that one-to-one support with children. So really it's just been a natural growth with our staff getting to know each other and just really working well together.
I think it'll be very, very impactful for the people that we are supporting, in that it's now one point of entry, so that there's continuity of care. So the type of service delivery and how we do it, whether it's the one-on-one service delivery that's currently in the bereavement support through the palliative care and hospice, or whether it's the peer-to-peer support, there'll be such a nice fluid transition between those kinds of supports, how that stylization works, and how educated our team is in delivering of those services. Kind of liken it like traveling through our school system, from kindergarten or grade school to middle school to high school. This is kind of partnership will allow that transition to happen almost seamlessly.
Yeah, combining our intake forms, so this one story, one time. You don't have to tell your story multiple times, because that can just be re-traumatizing. So having one intake form to allow the child and the family to get the appropriate supports is really key, so we can hopefully serve more people and spread that knowledge. And it's not just in Barrie, as we've said, to have a Season Center in your backyard is really a gift. And so that legacy, and to bring that forward to other children across the province and have a Seasons-like model within all hospices would be ideal, so that all children get really good bereavement support, because we know the impact of that early bereavement support will help them to develop into healthy adults.
I think it's extremely important that like-minded service providers work closely together for a number of reasons. One is to make sure we're not replicating each other's services. There's so much need and there's only so much service available. So I think that's really awesome that we're able to do that. The other, and on this particular thing, I think it's how we complement each other's services, and to make sure that, again, I'll go back to that continuity of care. There's a scale of economy that happens, that behind the scenes, not the actual service provided, but behind the scenes scales of economy that allow us to deliver more service dollars to the bottom line, really, which is providing support for the individuals. So I think that's really the key behind all this. And I think from a donor perspective, looking into it and seeing that kind of collaboration and understanding the journey from its beginning right through its whole lifespan is nice to be able to follow.
Yeah, this partnership has really allowed us to expand our programs as well. So we see people and children after somebody has died, but we can also support that child before their loved one dies. So for example, there may be a young parent in the community that has a couple of children. The parents, grandparents, aunts and uncles don't really know how to communicate the prognosis, and that, you know, mom or dad is going to pass away in, you know, the next upcoming months, weeks, or years. So parents really struggle with how to communicate that to their children. They want to be honest, but it's also very difficult, and how to find that language. So we can do some anticipatory grief work with children, and some legacy work with children before the parent or grandparent dies. So that's really, really unique. And then we can, after the death of the loved one, we can move them into either a peer-to-peer group, or we can move them into some one-to-one. So having that entire journey through until they're adults, right? They can stay with us for a long, long time, and build those friendships within the center. And so we just think that that's really key.
You know, along with that, we've taken an upstream approach, you know, meeting the child where they're at, you know, going into the school programs, not only just after somebody's died, but ahead of somebody passing away, or how before they experience that, to give them those grief understandings and the coping mechanisms that much of us get much later in life through experience. And we're trying to give them that upstream approach to that. So I think it's really, really important that this amalgamation takes you from that initial steps, you know, the upstream approach from the education elements, right through to the anticipatory, and right through to their age 24, hopefully through school process.
There's several ways on how the community can help these organizations, our organization, this new entity, to continue to grow and develop. And one is through volunteerism. We are both grassroots, volunteer-based organizations, and that is a very true statement to both of our organizations. We value that deeply. The vast majority of our programs are run and supported by volunteers, from one-to-one with our children to group facilitation. They're always mentored and supported by staff, but it is a volunteer-based organization, and without those volunteerism and those hours that are donated to us, we wouldn't be able to do this work. So we have retired teachers, we have retired child psychologists, we have retired nurses to retired professionals. Anybody that has worked and feels comfortable with children, you know, it would be beautiful for them to come and reach out and volunteer with us. That would be incredible.
There's 200 or 300 volunteers supporting us. So our biggest support program is our volunteers. But there's other ways you can help too. I mean, you can donate to whatever resonates well with you, whether it's a type of program or type of service. There's many ways to donate. And even though the short little dollars, monthly donations, right through to large foundational donations, all of those combine to bring us the ability to help several thousands of people on an annualized basis.
Yeah, so if you have a child that you are caring for, that you know is going through a loss of some sort, a death of a loved one, please reach out to Hospice Simcoe and/or Season Center to find that support. And both organizations would be willing to connect you with the right program.
Our services are complimentary, so don't let that be a barrier to your finance. Do yourself a favor and find the support that you need.